So I'm Saul Mundinger, MD MBA here at the Crane Center, and today we're talking about body contouring for masculinization. So for most patients, the technique of choice is liposuction. There are basically two techniques: liposuction, which really just removes fat from certain areas, and then liposuction combined with excision of skin. And that really depends on the quality of your skin, the areas where your fat is deposited, and how much we think we're going to kind of deflate those areas if we perform liposuction. The analogy I like to use is a balloon. You can take a certain amount of air out of a balloon before you notice that the shell of the balloon has become more lax and crinkly. The same thing is true for your fat deposits under your skin. I can take out a certain amount of fat and actually get some tightening of that skin envelope with time with the compression garment, which I'll talk about in a minute. In some cases, if I need to take out too much fat, I can actually deflate the balloon too much and increase your skin laxity to the point where we may need to cut out some of your skin. And that's an individual conversation that's different for every patient. But in general, liposuction usually does the trick for masculinizing the body. And all we're really doing with body contouring is removing fat from areas that are typically more accentuated in cis women. And just by that volume subtraction, we're able to accentuate areas that are more commonly seen in cis men. So typically for body contouring, what I'm doing is removing fat from the belly, removing fat from the outer hips and outer thighs, removing fat from the inner thighs, removing fat from the kind of the banana area on the under buttock area, and in some cases from the abdomen and lower back as well. And the goal with that is by removing the fat around the buttock and on the hips, we kind of accentuate the squareness of the buttock, accentuate how much of the buttock is really kind of visible through clothing, and then obviously remove fat depositions in those areas that we are evolutionarily designed to read as feminine, which is typically the under buttock area and lateral thighs. Compression garments are an absolute necessity after liposuction for 3 months. Without the compression garments, you really don't get kind of the smoothing of the skin around the areas that have been liposucted, and you don't really get a lot of that skin tightening that can occur after liposuction. It's really challenging to wear a compression garment for 3 months, but it is the most important thing you can do as a patient after surgery to optimize your results. Liposuction is not a terribly dangerous procedure for the areas that we're talking about and the volumes we're talking about. The biggest thing I think with liposuction from a patient perspective is that the discomfort after liposuction, I think, has really been downplayed or not talked a lot about. It's a very common procedure, but I think it's a lot more painful and patients are in a lot more discomfort after it than we commonly assume, because it's so frequently done and so frequently talked about in the media. Every area that I liposuct will be very tender for about 2 months after surgery. And particularly in the areas that we're talking about that are under a lot of pressure, you can imagine having your whole under buttock and inner thigh area liposucted, trying to sit at a desk if you work a desk job, trying to be out and active if you're working actively. All those areas are going to be very tender after surgery, and expect that. Again, not commonly talked about, and I think downplayed. Bruising after liposuction can be significant. It can last for a month to a month and a half, and we have pictures in the office to show you cases that have bruised, pretty extensively. But you can expect that every area that's liposucted will be tender, painful, bruised for a month and a half after surgery. Other risks of liposuction in the areas we're talking about are damage to skin nerves. The one we think about most commonly is called the lateral femoral cutaneous nerve that gives sensation to your lateral thigh. If that nerve is damaged during liposuction, it can be very painful to walk, and in some cases may need to be decompressed afterwards, although that, again, is very rare.
Thank you for watching this educational video on body contouring for masculinization with liposuction. Should you have any questions, please contact our office or visit us at cranects.com. Thank you.